Hello everyone, welcome back to the channel. I am here at the Great Salt Lake in the state of Utah, United States. The most common cancer in Utah is skin cancer or melanoma. And that is the topic for today, melanoma. Let's get started.
There are three common types of skin cancer: squamous cell cancer, basal cell cancer, and melanoma, which arise from different skin cells. Melanoma is the cancer of melanocytes. Melanocytes are the skin cells that produce an important pigment called melanin, which gives color to our skin. People with a fair complexion have less melanin, and those with a darker complexion have more melanin. Melanin does a very important function. Ultraviolet radiation in the sun rays can damage our DNA and cause cancer. Melanin absorbs these UV rays and acts like a shield to protect us. People with a lighter skin, hair, and eye color are at a higher risk. For this reason, melanoma is more common in countries like Australia, parts of Europe, and America. Having a weak immune system, especially due to certain medicines or organ transplantation or conditions like HIV, can also increase your risk of getting melanoma. Now let us discuss the warning signs. We all have birthmarks or moles. Moles are basically groups of melanocytes. Most of them are harmless, but some may turn bad. Be alert if you develop a new mole which you have never seen before, or if there is change in the appearance of an old mole. You can use the ABCDE rule to spot melanoma. A stands for asymmetry, means that the shape of the mole is not uniform and one half does not match the other. B for border, if the border is irregular and not smooth. C for color. Harmless moles are generally of one color, black or brown. Cancer moles may show different shades like black, brown, red, or blue. D for diameter. When the size is larger than 6 mm or the size of a pencil eraser. E for evolution. This is the most important. If there is a change in the size, shape, or color over time, you may need to meet your doctor. Commonly, melanoma happens in those body parts which are exposed to the sun, like face, neck, arms and legs, and back. But it can also happen in other areas like eyes, nose, mouth, or private parts. There are some people with many moles in their body, like more than 50 and 100. They need to be more watchful. So let us see how we can protect ourselves. Avoid too much UV radiation. It is the maximum between 10 a.m. and 4 p.m. If you can, limit going out in these hours. Always use sunscreen with an SPF of at least 30. An SPF of 30 is usually sufficient, but make sure to reapply the sunscreen every 2 hours. Wear protective clothing like hats, long sleeves, and sunglasses. Once a month, check your skin, head to toe, for any new spot which does not look normal. Remember A, B, C, D, E. Do not forget to look at your underarms, palms and soles, and private parts. These areas are usually missed. You can also visit a dermatologist once a year or when you spot something suspicious. Doctors check your skin using a device called dermatoscope, which is like a magnifying tool. Now let us discuss what will the doctor do if they find a suspicious spot. First step would be a biopsy. A small part of the skin will be removed and sent to the lab. Local anesthesia will be given to numb that area so you won't feel any pain. The pathologist will check if there is cancer or not and how deep into the skin it has gone. If a melanoma is confirmed, more tests are needed. We need to check if the cancer has spread to other parts of the body. For this, we need to do CT scans and PET scan. Treatment depends on the stage of melanoma. To calculate the stage, the doctor will check the thickness of the cancer, see if there is an ulcer or if it has spread to other areas of the body. Stage 1 melanoma is thin, less than 1 mm, and has not spread anywhere else. A surgery is done to remove the cancer and some nearby skin. Most patients are cured. Stage 2 melanoma is thicker, maybe ulcerated, but still has not spread anywhere. Surgery is done and a larger area of the skin is removed. Melanoma tends to first spread to the nearby lymph nodes, so the surgeon may also check these nearby lymph nodes for the presence of cancer. If the cancer has spread to nearby lymph nodes or skin, we call it a stage 3 melanoma. Surgeon removes the cancer along with the surrounding lymph nodes. In stage 3, there is a higher chance of cancer coming back after surgery. So you may get a medicine called immunotherapy for 1 year to reduce these chances. If the disease has spread to other organs like lungs, liver or brain, then it is called a stage 4 disease. Surgery is usually not possible at this stage. We know that chemotherapy is used in the fourth stage of other cancers. Unfortunately, in melanoma, chemotherapy is not very effective and causes a lot of side effects. So, the preferred treatment is immunotherapy, which will boost your immune system to fight against the cancer cells. You might know the former US President Jimmy Carter. He was diagnosed with stage 4 melanoma in 2015. His cancer had spread to his liver and brain. He started immunotherapy in 2015 and became free of cancer. He lived another 10 years and died last year of other old age related issues. So, even if you have stage 4 disease, don't lose hope. And there are these new treatment options available which are effective in most patients. Let us summarize the key points. Melanoma is a skin cancer which starts from the melanocytes which produce melanin. Melanin protects the DNA of our skin cells from UV radiation damage. New or changing moles should be checked using the ABCDE rule. Asymmetry, border irregularity, color changes, diameter more than 6 mm and evolution. Limit sun exposure, especially between 10 am and 4 pm. Use a sunscreen with an SPF of at least 30 and make sure to reapply every 2 hours. Wear protective clothing and check your skin monthly. Doctors confirm melanoma with a biopsy and may use CT or PET scans to check if it has spread to other parts of the body. Treatment depends on the stage. Early stages need surgery, while advanced stages use immunotherapy and targeted therapy. Thank you so much for your time. If you like the video, please share it with your family and friends. If you are new here, please check out my other videos and subscribe to the channel. We will meet again next week with another important topic. Until then, take care.